So it's 1:02 and I am going to go ahead and get started. People are still joining, but I would like to welcome you all to our professional development session today. We will be discussing regulation theories of monitoring and innovations in licensing. My name is Christy Como, and I am a quality assurance specialist with the National Center on Early Childhood Quality Assurance. And we have some very esteemed guests with us today that you're going to hear from, people that I consider to be pioneers in the field of licensing. And they are going to be presenting some information for you to consider and to think about, and hopefully you will be able to take some of the information and apply it in your daily work or maybe at an agency level. But we're very hopeful that you will enjoy this session. At this time, I am going to ask each of them to make brief introductions, and I'm going to start with Dr. Rick Fiene, a true pioneer in the field.
Hi, I'm Rick Fiene. I'm a research psychologist in regulatory science with the Research Institute for Key Indicators at Penn State.
Great, thank you, Dr. Fiene. Gwen?
Good afternoon, everyone. I'm Gwen Losser, and I am with the Tennessee Department of Human Services, and I am director over all of our child care services programs. I'll talk a little bit more about that when we begin.
Great, thank you, Gwen. Mark?
Mark Parker, I'm the president of Outlier Technologies. I've spent many years working with regulatory agencies and regulated businesses to help correct violations and prevent them from reoccurring.
Great, thank you so much, Mark. And then I'm also joined by my colleagues from the National Center on Early Childhood Quality Assurance, and I will turn it over to you, Amy.
Hey everyone, Amy Page. I'm an early childhood quality assurance consultant with the Quality Center, and I will pass it along to Shannon.
Good afternoon, everybody. My name is Shannon Smith, and I am a technical assistant specialist here at the National Center on Early Childhood Quality Assurance, and I will pass it to Asaph.
Hi everyone, I'm Asaph Alexander. I'm a program support specialist with the National Center on Early Childhood Quality Assurance.
Great, thank you, Asaph. Now, if you would advance the slide. So again, welcome and thank you all for being on this call today to hear this content from our esteemed colleagues. One of the things that we want to talk about today is the theories of monitoring that Dr. Fiene will speak to, and then you will see some very innovative strategies and practices from both Gwen and Mark. Part of the thing about licensing is that we know that it is evolving and licensing is becoming more high stakes. The other thing that we want to talk about today, though, is how does a licensing system relate to other systems in the state? What are the opportunities? What are the limitations? And where do we need to go from here? I think one of the things that I think about from a personal perspective when it comes to all my years in licensing is, boy, is it easy to come up with a lot of new ideas, right? But sometimes we hold on to the old things that we know for fear of the unknown, or maybe it's overwhelming, or it takes a lot of work, and it does. But we're at a point in the evolution of licensing that we really need to explore some of the ideas and ways that things can be done to make things better for licensing agencies, licensing staff, providers, and especially families. I've always said that the majority of people who work outside of licensing think that licensing is black and white, but we all know that there is a lot of gray in the system, and trying to articulate what it is and what it isn't can sometimes be very, very difficult. So hopefully today with the presentations, again, it'll spark some ideas for you to think about, maybe at an agency level, maybe it'll be at a personal level, but the intent is to give you information to help forward licensing across the United States. So with that being said, a couple of housekeeping items. This session is being recorded. It will take a few weeks for us to get it through the remediation process before we post it. But if there are people on your team who are not able to be present today for this session, they will have access to it at a recording. The second thing is, if you have questions or comments, we will try our best to get to them, but this is packed content today, and I expect that it'll go the whole duration. So simply put your questions or your comments in the chat box, and we will, if we have time, address them. If not, we will do our very best to respond to you individually. So at this time, I'm going to turn it over to Dr. Rick Fiene, again, a pioneer who has spent many, many years in the field of licensing. So thank you all again so very much for being here. Dr. Fiene, ASAP in advance. Thank you.
Hi, again, I'm Rick Fiene, and I'm going to talk to you a little bit, and I'm going to keep this really short today on licensing, measurement, and monitoring systems, some key elements and dichotomies, but I really want to leave plenty of time for both Gwen and Mark, because what I'm going to be talking about at a theoretical level, they're going to provide you with a great deal of practical examples. And I think that's really the essence of this presentation and everything. I'm the theorist, they're the practitioners, and I think you're going to want to really hear what they have to say, because it's very, very exciting what's going on. And they provide two very wonderful examples of what I'm going to be talking about at a theoretical level. Next slide, please. The other thing too is everything that I'm going to be saying over the next several slides is contained in this ebook that I wrote on licensing, measurement, and monitoring systems, regulatory science applied to human services regulatory administration. It's available on the National Association for Regulatory Administration's website. It's available on my website. You'll see my contact information in the last slide that I'll be providing. And maybe we can figure out some way of, having it available through the National Center as well. It provides all of the details, the things that I'll be talking about, plus a whole bunch of other things based upon, what I've researched over the past 50 years. I've been at this for a really long time in trying to, figure out what makes the most sense with all of this, in trying to move licensing, measurement, and monitoring systems forward. Next slide, please. So, as I said, it really boiled, and Christy said this too so nicely in her comments and everything. It really boils down to doing no harm versus doing good. I mean, that's the dynamic tension for licensing. The role of licensing when it comes to early care and education is finding that delicate balance, okay, where kids are healthy and safe, but at the same time, they're having a really positive, high quality experience. And at times, things fit together beautifully, hand in glove. And then there are other times where, there just may be that dynamic tension that, you pull on one side and you're giving on the other side and everything. And, so we have to be really sensitive to that. And all of the elements here kind of build off of this whole notion of doing no harm versus doing good. The tension between, or, kind of that balancing act between licensing and quality rating and improvement systems, professional development systems, accreditation. All of these systems all fit together very nicely. So all of these things I want you as licensing administrators, as licensing staff, there's no right or wrong answer with any of this. It's all about thinking about these things and where do you fit? You know, how important is it, for instance, being the gatekeeper versus being an enabler? That dynamic tension or that balance between how much enforcement, how much technical assistance, you know, the differences between risk and performance. You know, all of these things, there's, like I said, there's not a right or wrong answer. We don't have a, you know, a magical formula that says, well, if you do 80% of this and 20% of this, you know, you're going to wind up with a high quality program. We just don't know that. That's what this is all about, is finding out more. We're a young science. Licensing hasn't, you know, it's been around, but not for a long time when you think about some of the other sciences. And regulatory science has really only come into its own in the last 20 years. And it's right now really, really dominated by the pharmaceutical industry. Human services, just, you know, we're there. But if you look at a lot of the research, if you look at a lot of the funding, it's on the pharmaceutical side with the FDA, Food and Drug Administration and everything. Next slide, please. So what I wanted to do is just go over a few things related to what we do know at this particular point. And like I said, in my particular book that I wrote and everything, all of this is delineated in great detail. So I would highly recommend, take a look at that. Email me if you have questions. You know, take a look at my website and everything. Like I said, a lot of this is highlighted there. Licensing data are like no other data that I've ever encountered in the social sciences. One of the major things that you find with any licensing data is the lack of variance in data distribution. You know, the majority of the programs are either in full or substantial compliance. They're very, very tightly grouped that way, which is great. We would expect that to happen because we're dealing with health and safety requirements. You don't want to see a normally distributed curve because that's telling you, oh my gosh, I don't have very good programs here operating. So we want to see that, which is great. But from a research or statistical point of view, it's like a death blow. I mean, there's not a lot that you can do when it comes to skewed data. So over the past 50 years, what I've done is kind of looked at ways of analyzing these data that are nominally based, that are highly skewed, and coming up with statistical and research techniques to deal with them to make it more effective in how we go about researching and, you know, writing about, you know, these particular findings and everything. Okay, next slide, please. Okay, in this slide, talking about particular monitoring systems and how they have evolved. What you're going to see on a very, very practical level through Gwen's presentation and through Mark's presentation, examples of how we've evolved to the particular state where we are right now. You know, when I got involved in the field 50 years ago, very honestly, childcare had not taken off yet. This is going back to the 60s when Head Start was still a summer program, okay? It was a half-day summer program, that was it. The federal involvement in childcare was at a very, very low level. You know, states were involved in everything, but it was, you know, you could do things anecdotally. You could write case notes because there weren't a lot of programs. But in the late 60s and early 70s, things started to change dramatically. There was tremendous growth in the field. And there was a need that the anecdotal records just weren't going to do it, that we had to be thinking in terms of kind of instrument-based and tools that could be used where we could compare data across regions and states. The federal government was really, really interested in that. But what was the monitoring system going to look like in doing that? Was it going to be one based upon substantial compliance, or was it going to be monolithic? In other words, you had to be in full compliance with all of the rules and regulations. One of the first discoveries that I had when I started to look at the data, because I was concerned about how does regulatory compliance compare to program quality? So I started to do studies in that particular area. And what I discovered was a ceiling effect, that it wasn't so much about more or less regulations. It was about finding the right regulations. What are the right rules that make a difference? And that brought about us moving into differential monitoring, which is something that has been part of CCDBG as a voluntary way of monitoring your programs through abbreviated types of inspections, using key indicators, using risk assessments, okay? This is beginning to evolve today to more of an integrative type of monitoring approach, where we're combining regulatory compliance with program quality, which is starting to infuse program quality into rules and regulations. And with that, Gwen and Mark will be talking about that, how that's happening in a very unique way in Gwen's case in Tennessee, in Mark's case, many different types of examples in different jurisdictions that he's worked with. But we've got to find that balance, okay? How QRIS and licensing dovetail together, how program quality and program compliance work together, where we can have a strength-based, versus a deficit-based, situation, where we're doing things well versus do no harm. It's that delicate balance between the two. And then lastly, the whole notion, and I want you to think about this too, when you look at your particular rules and regulations, that all standards, do you look at them as being all created equally? Or are your standards, your rules, your regulations not created equal, and how are they administered? So, like I said, I want to stop at this particular point and let Gwen and Mark, talk about their particular examples, because I really think that they've got unique approaches that we can all learn from. Next slide, please. So here's my contact information, my email address, my website and everything. All of this will be available, through the National Center and everything. Please either email me or, go to my particular website. Like I said, that the ebook's free, so you can download it, as a PDF and what have you. And there's many other resources that are available too. So let me stop there. Let me turn it over to Gwen and Mark, and you can hear about some really, really unique, down-to-earth approaches to what I, as a theorist, have just presented to you. Thank you so much.
Thank you, Dr. Fiene. And again, sorry. Thank you for having me today. It's just, I really appreciate the opportunity to share what we are doing in Tennessee. And I think for context, it would be important for you to know a little bit about how we're structured in Tennessee, because I know that every state is structured a little differently. So I am with the Department of Human Services. I am the director over our child care services division, and within our division we have, of course, child care licensing. We also have our subsidy assistance program. We administer the QRIS, and we also have our quality initiatives. And so, and I'm CCDF co-state administrator. With that, I wanted to talk a little bit about our approach to monitoring and observation visits here in Tennessee. We kind of started a transformation activity back in early 2018, or actually it was late fall, it was in the fall of 2018. And so I'm going to be sharing this information with you about how our visioning, the strategies that we put in place just to kind of change our approach. So next slide, if you will. So again, in late fall of 2018, we began revisiting our current structure, where we are and where we wanted to move toward in our future state. And that led us to really transforming our business model and how we deliver our services. We went through a complete philosophy change and created a new vision for our future state. And this, of course, included an overhaul of our QRIS. Our QRIS had been in place since 2001. It really was an opportunity because we were one of the first, I think, 3 states to implement a statewide QRS during that time period. And we had years of data and feedback from child care agencies, and it was just an opportune time to begin to revisit that. And of course, with any kind of changes in your service delivery, there's also opportunities to align your staff with that. So, and then I want to talk a little bit about our resources and supports that we have in place to really help move the needle of quality. So next slide, if you will. So we had to talk about what it was we wanted to achieve with our future state. And that was really just transforming the entire industry in Tennessee. So for years and years and years, there was still that perception that some of our early childhood educators had of that, caregiver, babysitter, but we wanted to really move that needle for them to that full embracing of they are educators, right? They're working with children day in and day out. They're supporting those learning environments. They're keeping children safe and healthy throughout the day. So we wanted to make certain that we were putting in place resources, helping to change that perception to them being educators. And then, of course, with our own staff, with our licensing staff, we wanted to move away from being the enforcers. We wanted to see the child care agencies as partners. And because we felt like with that approach and building effective relationships, impactful relationships, that was going to really create that environment of trust and respect. And really build that integrity so that we understood their needs and could help deploy resources to meet those needs to help them improve in quality. And then our report card process that we had in place, our QRS, we wanted to move away with so much of a focus on the rating, but really that continuous quality improvement, because I don't think anyone is ever at 100%. There's always room for growth. And so it's opportunities to address how we can create that culture for that continuous improvement. And then our administrative task, we had to look at our systems as well. And we wanted to modernize all of our systems. And we wanted to make certain that the things that we were doing, we were taking away all those cumbersome activities that were included to more empowering. So that through this dynamic that things that we were doing on site and engaging with the providers, it was taking away that tactical aspect of it to where it was more enriched engagement. And then, of course, with capacity and looking at capacity across the state, we wanted to make certain that we were creating a system where we were being childcare creators and not obstructors. We were eliminating all those barriers and challenges that a lot of childcare agencies were having and even becoming licensed. So that was a big part of our modernization, our systems modernization, as well as how we addressed this approach. And then with the payment assistance piece of it for subsidy assistance, as well as being able to pay our childcare providers, that too, we wanted to reduce that administrative burden. And so with our systems modernization, we've created a provider portal to where they can do activities for licensing, as well as activities for reimbursements for children who are, of course, approved for families approved for childcare payment assistance. And then that allowed us to really focus on that continuity of care and develop those relationships with families on the front end to provide them with that very critical consumer education piece. So next slide, if you will, please. And then, of course, we wanted to develop our goals for achieving this future state, right? And then the purpose of what we're doing, and that was the why of our work. We all came together and we had read, our leadership, we had read Simon Sinek's Start With Why, which was very important in thinking through. We usually know what we're doing, how we're doing it, but why are we doing this work? And so really the whole foundation is that we feel that every family should have access to quality care for their children. And so that was really the basis for everything that we do. And then the goals that we set are to improve quality. And by improving quality is revisiting our model in how we monitor for compliance, how we evaluate quality, the resources that we put in place to support that quality improvement, and then increasing access, making it easier for child care agencies to participate in the child care payment assistance program. And then, of course, again, through all of our systems modernization efforts, really strengthening that business efficiency. And the business efficiency also encapsulates our procedures and our processes within the department. So next slide, if you will. And then I want to talk a little bit about our QRIS redesign. Again, as I stated, ours had been in place since 2001. And it was structured, we had 2 units. We had our licensing unit and we had our assessment unit. Licensing was, again, going out and monitoring for compliance, and our assessment unit was going out and they were evaluating the quality piece. Our licensing team were going out several times a year. Assessment team was going out and looking at the program 1 time a year using the environment rating scales. And so there was some disconnect there with really looking at the bigger picture of what a child care program is offering, how they're structured, what they're delivering, being in compliance with the health and safety standards, as well as what are they doing to create those educationally rich environments to support children's development, just to really spark that curiosity and creativity and the ongoing learning. So that was part of what we wanted to address during our QRIS redesign. And also the other disconnect that we had is there was not that immediate feedback from what those scales, the score on those scales were providing, and what the licensing team were seeing throughout the year, and incorporating the violations that were occurring. And so those were some of the key issues that we wanted to address with our redesign. So next slide, if you will. So we started, as stated, back in 2018 with the strategic plan, what we wanted to accomplish, and our why. And then we had, of course, years of data from our QRIS, and we also had years of feedback from childcare agencies that we had been capturing. And then we became very intentionally focused on what it was that we wanted to address. And so we incorporated a process that included a consultant that came in and did focus groups for us, They evaluate our systems. They looked at other states and best practices, did through literature review and some peer-to-peer, peer state conversations that occurred. And through those focus groups too, we had that immediate feedback from staff, from childcare providers, from community partners, all of our key stakeholders. And some of the things that we saw was really the process. The process was burdensome, it was redundant, and it was inefficient. Because there were all those disconnects that I had described. There wasn't really that support that was coming together when you had the results of all this information of how we were going to effectively assist a childcare agency in moving their needle of quality. And then the content, it really, lacked focus on those quality elements, those key indicators that really are matter the most for children and really driving those successful outcomes. And then the purpose, there was more emphasis on compliance and measurement than that holistic approach of how do we elevate the program and improve quality. So next slide, if you will. So our big ideas that came out of our QRIS redesign and all of this information that we had gathered in these focus groups is that we really wanted to streamline our processes and have ongoing engagement support that provided us with a more accurate picture of quality. And when I was talking about our engagement with our licensing unit going out, they had more of a, I guess, that relationship, that initial relationship with the childcare agencies. They kind of understood what was going on in that program because they were visiting throughout the year. Those folks who were doing the assessment of quality using that tool were just looking at those, it's an academic tool, and they were just looking at that environment for the day. And so it wasn't really given that overall picture of what was going on in that program throughout the year. And we heard that from providers a lot too. They referred to the assessment as the picture day because it was just that snapshot in time. And so that was one of the areas that we wanted to address. The second one was the program quality defined by the strongest predictors of child outcomes. So what we did is, and I'll talk a little bit more about the tool development in a moment, but we wanted to think about our own early learning standards in Tennessee, best practices from caring for our children, other things that we have learned throughout the years based on research, and how do we incorporate that into a content that is really going to drive those outcomes for children. So that we're continuing in those specific targeted areas. And then of course the last is that purpose. And with the purpose, it's that the programs throughout those engagements throughout the year are receiving those really targeted, relationship focused coaching. We do that through technical assistance. We do it through connecting to resources through our quality partners, such as CCR&R, for additional targeted technical assistance. And so it's really that focus on how we engage with that childcare agency. And then making certain that we had financial supports really to mitigate some of those higher risk items and help them come into compliance or help them to improve overall quality. And then the last piece, of course, is for our families who are consumers of these services, to make certain that we're giving them information so that they can see that the program that the child care agency is offering is going to be the best fit for their child and meet their needs. Next slide, if you will. Now I want to talk a little bit about the tool development. So we were thinking that we did want to develop our own tool. We wanted to develop our tool incorporating all of the information that I was just talking about, our early learning standards, as well as those very important teacher-child interactions. But it also included those health and safety standards, right? Because it's all quality. It all promotes the overall well-being of a child and their growth. And so we wanted to make certain that the tool just incorporated all of that information. And it was so funny because we had started having these conversations, and in the summer of 2019, I went to a QRIS conference, and at that time there was a gentleman from Ohio, and he was doing a presentation, and he was talking how he had addressed these very things. He was talking about how licensing was on one side of the aisle and assessment was on the other side of the aisle. It didn't make sense to them either. And they had developed a tool that incorporated a lot of what I'm talking about, using Race to the Top funds. So we took a team and visited them in January of 2020, just prior to COVID, to understand lessons learned, to look at their tool, and to get information from them on how they approached this change. And so we did adapt their tool. We took the tool that they had, and what we did was we aligned it to our visioning. And so we incorporated, of course, the early learning standards from Tennessee, as well as some best practices. We wanted to make certain that we incorporated our rules into the tool, so that when we are out and we are using our QRS tool, we are not only evaluating the quality, but we're monitoring for compliance with our rules and standards. It's all one tool. And so that was the approach that we wanted to take when we were developing our tool. And so our staff go out 4 times a year. There are 3 announced visits. There is 1 unannounced visit. When they are out, they are able to use the tool, because our system, when we did our rip and replace of our system, our licensing system, we have embedded the tool in the system. So they go out with tablets and they're able to go through the tool. It's in 2 sections. There's a health and safety section, and there's a teacher-child interaction section. And they're able to go through all of the indicators on the tool that are inclusive, again, of our rules, as well as those standards that we want to evaluate for quality. And they're able to provide that immediate feedback to that child care provider after they have done the scoring. And so throughout the year, the score is only available to the child care agency. And then everyone is on the same cycle from October through September. And at the end of that time period, the scores will be posted. Now, we just launched this year. We launched in, it was this federal fiscal year. They launched in October 1st of 2022. So we're still in that period of transition. We're in that first full year of implementation. And so it's our opportunity to launch, learn, tweak. And with that said, we have already had 2 iterations of changes to our tool. And so when we're doing this, of course, we have engaged our child care providers throughout this entire process. Even when we were doing rules revisions, child care agencies had a voice at the table. They were involved in rules committees. They were involved in information sessions. We have engaged them throughout the process to ensure that they do have a voice in this process. It creates that buy-in, that understanding of what this approach is going to look like. And so again, that annual score is based on that overall average of those 4 visits. The violations are captured in the tool, and I'll explain that a little bit when I go through the tool itself, so that they get, if they're not meeting all the required evidence for each of those indicators, then it goes to unmet. But then because of the rules, if it's an actual rule, it could be that it goes to either technical assistance or that it would go on to a violation. But regardless, if they don't meet all the required evidence within that element or in that indicator, then they don't get the points. They don't get the quality points. So that's kind of the structure of the tool, the way that we wanted it to work. Next slide, if you will. And so the way that the scoring works is that each element indicator on the observation tool is scored based on the required evidence, as I was talking about. So it's very specifically listed on what they need to meet to achieve a score of met on an item. All of our child care agencies have been trained on this. Our partners at CCR&R did a wonderful training for them. We continue with engagement sessions to gather feedback during this transition period on how this is working for them. And then so that we are able to, again, tweak as we go along. But the score for both the health and safety and the teacher-child interactions are combined to create that overall score for the quarterly visit. Upon completion of the quarterly visit and prior to departure, that's when our team are fully engaging with the provider to help them understand what they did really well and areas that still need improvement. And it's also that opportunity at that time to address those areas where there may be some improvement needed, and we wrap around resources. And we have another system in place. It's a referral system where our quality partners are connected so that we can, at that time, we can do a referral. And we talk specifically about what those areas are that need to be addressed. But the thing that we've learned throughout this process is that providers do see this as a partnership. They don't feel like this is being done to them. They feel like we're working in partnership with them to promote and elevate the quality and to address any areas where they may need to meet compliance with rules or other areas where they just need to improve overall. So next slide, if you will. So our quality score is 80% or above, and this is the breakdown. Anything below the 80th percentile is an area needing improvement. And of course, with our scoring, we're still going to tie reimbursement rates, the quality level, to the reimbursement rates for children families who've been approved for the child care payment assistance. So scores between 80 to 89 will get a 15% bonus above the state rates, and scores between 90 to 100 will receive a 20% bonus. And so that's how the tool is structured with a scoring. And then next slide, if you will. So at each visit, as you may be wondering, how are we structuring what we're evaluating? So at each visit, we are looking at those critical items, those critical health and safety items that must be scored. And again, that's at each one of those quarterly visits. Able to select one of those sections that there'll be a scoring in addition to those 11 critical items on that health and safety piece of the tool. And so it's broken down: supervision practices, facilities equipment, record keeping, healthy weight practices, disease prevention, and then their org structure and qualifications. So those are the sections. So they would, with the health and safety tool, they would do the 11 items, and then they could pick one of those 4 that they're going to evaluate. And then the teacher-child interactions, the way that they're evaluating that is they're looking at a classroom from each of the age groups that the provider is, that they're evaluating during that quarterly visit, so that by the time at the end of the year, they have looked at every one of those classrooms throughout the year. So that's how the tool is structured, with the critical items and how we're scoring. And if you will, next slide. So this is just a scoring example, and this is how the tool is structured. And this is one of the elements is talking about early learning activities and routines. And again, some of these required evidences have changed. since I had captured these screenshots because our tool has gone through again. Our last iteration was released in July. But this is just, we're looking at inclusiveness of choice and balance of teacher-child initiated activities. And so it lists out all of the required evidence that they must meet. And so that's what our team would be looking for that particular indicator. And then this is just an example of met. Next slide, if you will, please. And this one is just an example of not met. So as you can see, the last piece was not met. So that means that the full indicator is scored as not met. And again, as I was talking earlier, these indicators, depending on what the topic is, may have a balance of rules and quality incorporated in it, because we have basic standards for rules, and then we have what it would look like to go above and beyond for quality level. And so they would have to meet each of those required evidence to make certain that they meet the full quality indicator. And then next slide, if you will, please. And then we do have some indicators that are not applicable, because if an agency is not providing transportation, of course, we're not going to score them for transportation. And so those scores would not count against them. And one of the things too that I wanted to think through as we were applying this tool is that it's an opportunity, as if it's a rule, and again, as it goes through our system, our checklist system, if it's the required evidence that is to be met, if it's a rule, it goes to a violation driver. And at that time, our staff can determine, are they going to apply technical assistance at that point, or are they going to let it go on down and cite it as a violation? So the provider at that time has that immediate feedback too, that they have been cited for a violation, plus they do not get the points, the overall points for quality. So that's kind of the tool and how it's structured. I've seen a lot of questions pop in. I'm trying not to look at them right now, but I think at this time I'm going to turn it over to Mark, who is going to provide an example.
All right, thank you, Gwen. Let me shift this over to my screen. All right, so this first example, it actually builds off of the example that Gwen was just sharing. But instead of using a spreadsheet type format, we're using a licensing measurement and monitoring system to do essentially the same function. So just to kind of give you a lay of the land here, on the left-hand side, these buttons are used to navigate the different parts of the inspection. And on the right-hand side is where the data entry occurs. So this is essentially the same element or indicator that Gwen was showing. And we're utilizing something called tick lists. And these tick lists allow the licensing staff to go through as they're making these observations and just check these things off as they're going. And in some cases, they may make a few observations. They may go to another tick list, make a few other observations, but we're giving them those lists to help them make sure they're working through the process properly. What the system also does is if they've not marked all of these as complete and they try and mark this as met, it gives that indication that you can't mark met unless all the tick list items are completed. So we're asking a lot of the licensing staff to not only do the compliance part, but also start to do the quality part as well. So as much as we can, we want to lean on the technology so that it provides those reminders and it helps the staff work through the process so we can get as accurate, precise data as possible. So that's the first example. The second example I wanted to talk through quickly. Actually, we refer to it as mini inspections. And I don't want to confuse mini inspections with abbreviated inspections or differential monitoring inspections. What I mean by mini inspections is we're taking the full inspection and we're breaking it down into smaller components. So we're breaking it down into classrooms, or we're breaking it down into a staff record or children's records. And as we're going through the inspection, we're just focusing on those areas. So when I'm in a classroom, all I've got to do is focus on that classroom. So all of these checklists, the way they're set up, and there's actually 10 organized here, and we can rename the actual name of the classroom, but the list that we're going through is the same. And the reason that this actually came about was because we observed inspectors, they didn't carry their technology with them. Even though they had a tablet, had a piece of technology, they would set it down, grab a notepad, and start walking through the facility, making notes. And the reason they're doing it is because when they go in the first classroom, and let's say, for example, they observe staff-child ratios, if they have inspection forms that just have one place to mark compliant or non-compliant for staff-child ratios, they can't mark it yet. They've got to wait until they look at classrooms 3, 4, 5, all the way through 10 or whatever. So they needed to make some notes. They weren't ready to fill out the official forms. So what this process does, is it actually allows the inspector just to click things, check things off, so they can look at the requirement, check it off as compliant, and they're only really documenting compliance with meal times in this Redbird classroom. Now, obviously, there are times when there are non-compliances. In this case, what happens is they're presented with a list of standard findings. These are pre-written descriptions of common violations that really speed up the process of documenting violations. Again, we're trying to take that pressure off of the inspectors. They're doing all this additional work with doing the quality and the compliance part of it. So by selecting one of these predefined standards, we've got a sentence that's already subbed in for them. Now they can put their cursor in here, excuse me. They can put their cursor in and change any of this. But the way this is set up is that there are these placeholders. And you'll also see here this requirement number is not filled in. So all the staff will need to do is click this builder, and they can finish the sentence by just clicking their way through. A child did not wash their hands with warm running water, soap and running water before, next, and we'll say, let me back, after, next, using a toilet. All that's been authored by the system, and most importantly, that regulation number got populated automatically based on the selections that the inspector made. So we're getting very accurate data. We're able to move through and do the inspection very efficiently. But here's the other really cool byproduct of this. Because we're actually looking at each individual classroom and we're looking at the same elements in each individual classroom, we've actually got more data points than just compliant, non-compliance. We've got compliant, non-compliant with all these different regulations in each classroom. So the beauty of having the system is that we can rely on the technology to do those calculations and also create that final report. And if you'll notice, the actual report here is in regulation order based on the rule book. But that checklist that the inspector went through, it only pulled out the items that were necessary in the classroom. So as I scroll down here and look at these non-compliances, well, this was another one, outdoor play. But I can see for hygiene in the Bluebird classroom, we had this finding, and in that Redbird classroom, this is the finding that I documented. So think about it from this perspective. We've inspected 10 classrooms. In 2 of the classrooms, there were hygiene issues. So we could look at it and say, well, that's 80% compliance. And maybe we could attach a substantial compliance or a partial compliance. That's not the case right now. So in this agency that we work with, it's all or nothing. But what's exciting about this is that because of the way we are breaking things down into mini inspections, it gives us opportunity to score things. And we're actually taking a lot of that responsibility off of the licensing staff's plate and really relying on the system to do a lot of this work. All right, so I'm going to switch back into the slide deck and pass this back off to Gwen.
Thank you, Mark. So the next thing I want to talk about is how we align staff with the vision. And I've been seeing a lot of comments in the chat about, I know caseloads are high in a lot of states, and that's why I kind of provided that context in the beginning about our structure in Tennessee, and some of these pieces were made it a little easier because we are centralized. But I also understand that we have about 2,400 licensed childcare agencies in Tennessee, and I know some states have a lot more than that. I did want to talk a little bit about how we aligned our staffing with the vision. And Mark, to your point, system support is key. One of the other pieces that we did as we were creating all of this transformation was to think through all the different system supports that we had in place. It wasn't only the rip and replace of our licensing system, but we created a workforce registry, and the workforce registry houses the credentials and training for all educators and administrators in the state. And that's a tool that we use to go in and verify that those trainings are complete, so that we're not having to visit those files on site when we're out conducting those visits. That's another one of those administrative burdens that was reduced by creating a more automated process to do that. So it's real important as you're creating or redesigning any structure, I think, is to think through all the pieces and how you can pull them together to make certain that you are creating those efficiencies in your approach. So with that, if you will, next slide. So we had, of course, I said the licensing staff, and we had the assessment staff, and we wanted, through our new approach, to think about some of the tasks that we could take off of our staff who are going out and doing those quarterly visits, such as licensing new entities. What made more sense for that piece? So we came up with two separate approaches within our licensing division. One is that of field operations, and the field operations work with all of the existing licensed programs. It's divided into a director of field operations. There are 6 regional managers. We have 21 field supervisors and 122 licensing consultants. And as you can see, their current caseload is about 1 to 20. We also wanted that potential for growth. What would that look like? So we wanted to make certain that the caseload stayed around 1 to 25, didn't go over that. And then we thought about new entities that are opening. And in the past, the way we had it is our field staff also open new entities. And a lot of times the way that looked was, here's a packet of information, please review, you need to attend an orientation, and here's all the inspections and the things that need to be done. And then they would open the entity. I know that's minimizing it a little bit, but we wanted more of a focus on how we were opening new agencies. And really that those new agencies understood that it is a business first and foremost. And then we know that with childcare is one of the more heavily regulated industries. And so there's a lot in learning the rules, the different pieces that go into operating a childcare facility. So we created a pre-licensure unit. And with the pre-licensure unit, they have a very structured process in how they're engaging with a new entity to onboard them. And so it starts with an inquiry. And all this is in our new system as well, our new e-licensing system. And so they engage with them at the point of just an inquiry. And then they assess kind of where they are. They talk to them about that. You know, they may not have a building yet. What is involved? And then they attend an orientation. And this unit is also able to help them navigate local codes and zoning. and understand those inspections. And then we have several trainings that they attend as well. And one of those is a small business academy. And so that's through our partners with CCR&R. So there are these warm handoffs throughout the process as well to make certain that they're building that strong foundation as a business so that they are sustainable, and they're getting that support on what are the rules, what is it to offer a quality program, what does that involve. And so that group with the pre-licensure unit is very intentional and focused on that, so that we're supporting opening sustainable quality programs moving forward. So that unit right now has a director, 2 program managers, and 12 program specialists who are working statewide. So, and with the creation of the licensing consultant role, it used to be called a program evaluator. We wanted to find a title that really incorporated that monitoring for compliance, as well as being that resource and that supportive partner. And so we changed it to a licensing consultant. And with that, we were able to bump up the salary as well, the salary scale for that role. And so I know I saw a question asked about that in the chat too. So we were able to address that at the time we were creating these new roles to support our process. So next slide, if you will. So with our field operations support, again, they conduct the quarterly visits. They also do complaint investigations, and they, of course, are going back and doing follow-up visits if there's a safety plan or another legal enforcement action. But the main goal for them is to really strengthen those relationships and work in partnership for that continuous quality improvement. And again, understanding the program, they really understand the needs of that program. So they're able to provide that immediate, feedback, that immediate follow-up with resources that they need to help them with that continuous improvement. And so that's been kind of the overall structure of our new approach with our license, with our teams. So I think I'm turning it back over to you again.
You are. All right. So my next example, it has to do with corrections. And I'll just bring up this graphic quickly. It's something I refer to as the compliance monitoring cycle. There's really 3 phases to it. There's the inspection phase, which we've kind of already talked about. There's the correction phase and the prevention phase. And really what we want to do here, once we've identified those violations or areas of improvement, we want to work with the providers to get those corrected. And we'll talk about that more in just a minute. But if we get providers bought into continuous quality improvement, that's really where the prevention comes in. So they're actually mindful of compliance and quality throughout the entire licensing period. But it's tricky to get to this point. It takes time. It's more of an evolution. It's not a change. So I do want to talk through this in a little bit more detail. And let me switch back to this screen and talk about this example. Big believer in allowing people to fix problems themselves, come up with solutions, understand what the root cause is, and come up with their own solutions to problems. They're more bought into it, and they're more likely to follow through and make sure that things don't happen. So the role really changes from being maybe an inspector, just identifying violations, to being more of that consultant or mediator of thought. That's a term I've heard recently, where we help people think through the root cause of violations, and we help them think through their plan of correction. We don't do it for them. Or maybe in some cases, we may need to direct a plan of correction. But for the most part, we're just facilitating that thought process for the provider. And we provide them with tools that allow them to document a plan of correction and submit it electronically. So this is a tool, just to give you a little lay of the land. It's a licensee portal. Providers get a copy of the inspection. In that email, there's a link that allows them to set up an account. Once they've set up the account, they can come in and respond to violations electronically. So when I pull this up, what I'm essentially looking at here is a statement of deficiencies on the right-hand side. And then we can navigate to the different areas of non-compliance by using these buttons on the left. So this, just in the actual statement of deficiencies, there's a place for the provider to write up their plan of correction. The challenge with it is it's pretty overwhelming for most providers. And what a lot of agencies have experienced is that it takes a lot more time. And it's just easier to go out and do that reinspection, go out and check up on them, make sure they're doing things right. But this process of going through and doing root cause analysis and coming up with that plan, it really is the fundamentals of continuous quality improvement. And that's why it's so important for providers to have the ability to do this themselves. So in this example, it does provide some instructions for the provider. Unfortunately, what happens if a provider is really just given a white space to type up their plan of correction, the POC looks something like this. We will ensure all liquids are kept in their original containers at all times. If that was submitted, I'm sure the licensing rep is going to, okay, well, who's going to do it? When are you going to do it? There's so many other things that we need when it comes to a plan of correction to be able to approve it. So a tool that's being utilized, and this is fairly new, is something called a POC writer, or it's a template that assists the provider with coming up with their plan of correction. So instead of just working with a blank spot on a form, there's a template that they can work through. And understand that this is all about giving the providers the ability to come up with these solutions themselves, come up with corrections to the violations. But the licensing staff, plus the tool, we can kind of work with them and help them through the process. So just to give you a sense of what we're looking at here, at the top, we're seeing the actual finding, what was cited. There's also a way to look back at the regulation and just see what it was. But this plan of correction is divided into three parts. It's the immediate action. What did they do to address the violation immediately? What are the preventative actions that they're going to take? And the third part is compliance monitoring. What are they going to do internally to make sure that this violation doesn't happen again? That's the fundamentals of continuous quality improvement. We've got to get to understand the problem and get it addressed immediately, but we need to come up with that plan to prevent it from happening in the future. So instead of getting a white space, they're entering a date, a position, and some of this is already pre-filled out, just so I'm not typing during the session. So this is the first action, to remove the bottle. And the second is to check all the other resident rooms. So those are two different people. So a shift supervisor and an administrator went out and did that work, those immediate actions. The next part of this process, and it's probably one of the most important, is getting to the root cause. Why did this violation happen? The why is so critical. The challenge is, in order to get to why, you normally have to go and speak with staff. So the administrator is going to have to go speak with some of the caregivers, or maybe janitorial staff or someone, and try and find out what happened. What was the root cause of this? It's very difficult to do that when you approach people and you say, why did you do it? Who is responsible for it? So there's types of questions that can be asked to help get to the why, but you do it without asking why. So I'm doing a session next week or the week after next at NARA. The title of it is Getting to Why Without Asking Why. And it's all about root cause analysis. And it's all about how to have those conversations with administrators and to help administrators with having those discussions with their staff to really get to the root cause. And it's not really a piece of technology, it's more of a technique that's used. It's called using powerful questions to actually get people to share what the root cause is. So that would be done really as part of the immediate action. Don't always document the root cause or all the work that was done, but there normally is some type of root cause analysis that's done as part of the immediate actions. We then move on to the preventative actions. Now that we have corrected it, and we've determined what the root cause is, what are the things we're going to do to actually prevent this from happening in the future? So we've entered a start date, the position, and we're going to update the resident room daily checklist to include bottle checks. And we're going to do that, update the list on the same date. Then we're going to go to the second action, provide training to shift supervisors and caregivers on the updated checklist. They can continue to add actions. So if they've got other steps that they're going to go through to correct or to prevent the violation from occurring, they can continue to add additional steps. And you'll see there's prompts throughout here. So finish this sentence, the designated staff member will. So we're helping them through the process. There's also all kinds of instructions that are provided right online when staff are filling this out, or I'm sorry, providers are filling this out, so that they kind of see what's being built up or understand the information and the way it's being entered. So I'm going to remove that last corrective action and then go to the overall completion date. So we want to know if you're going to take multiple steps, when's that final step going to be completed? So that's the prevention phase. The last part of it is the compliance monitoring. Now that we've implemented the correction and we've started looking at the prevention and doing all that, we've got to document the activity that we're going to do, make sure that we continue to do it on an ongoing basis. So we'll do the operations manager, and they're going to do, we'll say weekly, and the activity will be weekly checks. And they're going to do this, and we'll say until, say, November 30th. So for a couple of months, the operations manager is going to go out and make sure that the work that's been assigned during the preventative or the plan of improvement is actually being executed. So that really, and now with these check marks, I can see that everything is complete. So all the provider needs to do at this point is to save and write. And ultimately what it's done is it's taken that information, all those critical data points, and it's formed the sentences that are needed so that the provider can submit an acceptable plan of correction. We're not writing it for them. They still have to describe what it is they're going to do. But what's most important is we get all those critical data points and we get the providers focused on, I've got to make sure that I'm assigning the right work to the right person and get the dates and so forth right. You don't have to think about authoring or writing something from scratch. And what we're experiencing is that when this type of template is provided with the additional assistance of the inspector, helping them think through the root cause analysis, helping them think through their plan of correction, that they're submitting these and they're getting approved at the right time. But more importantly, what we're teaching them applies to all other parts of their business. If they're having a human resource issue, they need to get to the root cause. Once they get to the root cause, put a plan of improvement in place and then monitor it on an ongoing basis to make sure it's taking effect. So all of this starts to build these practices and routines in the business that helps to make it better. The last point I want to make is the providers are really buying into this, mainly because their corrective actions, their plans of improvement are getting posted on public websites. So right now when agencies are posting inspections, normally it's all the negative, it's the violations, and maybe the re-inspections get posted. But providers are buying into this because it's their opportunity to share what they're going to do to improve their operations. And in some ways, it's holding them accountable. We're making it public. But more importantly, they have that opportunity to respond. So we're seeing this really as an emerging trend, really focusing more on the correction and the prevention part. Obviously, we've got to do those inspections, but really working with the providers to make sure things get corrected and they're preventing violations from happening in the future. And I am going to, I'm going to pass this back. So Asaf, if you can take control, that would be great.
Thank you. Thank you, Mark. And again, you know, as we talk about whatever approach you're taking to make certain those system supports are there. And we were very intentional about that as well with the provider engagement with us through automated processes. And so having the ability for them to provide us with their plans of corrective action through their provider portal has been a key piece of that, so that we again are reducing that administrative burden on them. And then also we have document retention in our system, and they can go back and see these documents. It's just an opportunity to further support what they need to be focusing on, and that is their program, and reducing those administrative tasks for them. So again, through the pre-licensure support unit, I kind of covered this a little bit as we were talking. We launched it in 2021 as we were going through our staff alignment, and it's really just to streamline those processes and increase the support for the new agencies. Because we wanted, again, our field operations team to really be able to focus solely on those existing providers and how they can help support them and that continuous improvement. And so with the pre-licensure unit, of course, they're delivering training, they're equipping the agencies with the tools that they need to be successful businesses by routing them through the small business academies, also to help them fully understand the rules that are in place. Again, assisting with those tricky codes, local codes and zoning requirements. That's a big piece. So that our growing capacity across the state is really reducing those barriers, those challenges for them. And it really helps support too that we're opening those quality entities. And so I have a creation of over 13,200 slots, and that was, it's increased a little bit more. We've actually in the past 2 months have added an additional 1,300 slots of capacity. So I'm very excited about the work that this unit is doing, as well as our field operations unit. So next slide, if you will. And then there, of course, we designed all of this to keep in mind that we knew the agencies would need some financial supports as well. So with our pre-licensure team, as they're working with new agencies, there is one-time startup costs for up to $1,000 per slot of capacity, not to exceed $100,000. And that's for furniture, equipment, supplies, materials they may need, curriculum to open their doors as a quality program. The main requirements is that they are, of course, going through the pre-licensure process, that they're completing the Small Business Academy, and that they agree to participate in subsidy. So that is a key part of that establishment grant. And next slide, if you will. And then another key piece is that warm handoff from provisional period to continuous license, because we want to make certain that those relationships are being created as we move from one entity to the next. And so as they're passing off from the pre-licensure team to the licensing consultant who is going to be absorbing that new agency in their caseload, that they are building that relationship throughout that process. So next slide. And then the last thing I wanted to talk about were just some additional resources, tools, and supports that we have in place. As I was saying, as our team are out there conducting those quarterly visits, going through that QRIS tool with the agency monitoring for compliance, as well as evaluating quality, that when they do see those areas of improvement, that they're providing those immediate resources and tools to help them to meet those deficiencies. So next slide, if you will. So we have, as a companion grant to the establishment, there is an expansion grant as well. So it's any entity that may be an existing entity that is opening a new classroom, they can apply for that $1,000 per slot as well. And then we have support and enhancement grants that are available. The enhancement grants, a child care agency may apply one time per contract cycle, which is from October to September. There is a base amount that they can apply for, because, you know, with continuous improvement, there also needs to be some changes and things. And so they can apply for $4,000 with additional $1,000 for these qualifiers. If their agency is in one of the identified economically distressed counties, there are 8 in the state. They complete an infant toddler specialization credential if they offer an infant toddler program. They're seeking national accreditation, or they're participating in the certificate program, or if it's to remediate an issue for compliance. So, and then next slide. And then additional quality supports, we have implemented the wages program, and all of these supports that we have in place are available statewide. So regardless of where this agency is located, they can access these resources. So the wages program, as many of you know, is a supplement to their salary is paid directly to the educator twice per year, as long as they're continuing to work for the agency that they started with when they applied for the wages, and they're continuing their professional development. And it starts on a scale of 600 and goes up to 7,800, depending on where they are on that scale. And then, of course, our partners with Child Care Resource and Referral, they have a network of coaches that can go on site, provide any coaching, mentoring, targeted technical assistance that needs to be provided. They do the infant toddler specialization. They also have a preschool specialization that launched this year, but their coaches include the infant toddler coaches, the family engagement quality coaches, health and well-being coaches, as well as inclusion quality coaches, because we're really putting an emphasis on supporting agencies to provide those inclusionary services. And then we have a program called Tech Goes Home, because as I've been talking about the transformation and modernization with systems, not everyone is tech savvy. So we wanted that opportunity for them to be able to apply for training and devices. So with the Tech Goes Home program, they go through a series of training modules, and then they get devices at the end of that training, so that it supports their business practices or their ongoing professional development. And then, of course, there is the Small Business Academy. We put it in our rules that it's now a requirement for any new agency or any new director coming into an existing program that they go through the Small Business Academy, because it just equips them with, again, those things like human resources issues that may come up, budget planning, all those things that support a successful business. Next slide. And then we do have Child Care Tennessee. We had put in place shared services model. It allows for bulk purchasing, substitute pool. They have a resource center there. And then we have our Tennessee Early Child Early Care Training Alliance TECTA program. This is our ongoing professional development program. It provides tuition assistance and supports. It also has an administrative credential as well as an infant toddler credential. There's a network across the state of TECTA sites where someone can get their CDA, they can get their go on to get their their bachelor's or their master's in early childhood through tuition support as well. And then we have our family child care network that is operated currently through our higher ed, but we're transitioning that one in October to our CCR&R, just for that, really that grassroots foundation that they have built across the state in community engagement. So we thought that better aligned with them for recruiting of new family child care agencies. And then last slide, I think. Yeah, these are resources. So I think this PowerPoint is going to be shared. It does have our current tool on there, as well as all these resources that we're providing, and then my contact information. And again, I just wanted to thank you for allowing me to share what we're doing in Tennessee. I know each state structures so differently, but it's just the main point, I guess, is just how we are evaluating our child care providers, because it is all quality. We see it as everything that a child care agency does is part of that quality that promotes those successful outcomes for children. And that's why we wanted to really change our visioning and our approach to how we deliver our work. So thank you for allowing me to share today. And I'm going to turn it back over to you, Christy, I think.
Thank you so much, Gwen and Mark and Dr. Fiene. Every time I listen to you all, I think about more things in the field of licensing, and it is really exciting. I think, as Dr. Fiene said earlier, things have really changed in licensing from years ago, and it's exciting to be able to see innovative practices such as the state of Tennessee to blend all of it together in a way. I think the word Gwen used was holistic, a holistic approach. I think that's also very important because from parents, from a parent viewpoint, when you have different systems that are communicating very different things, it can be very confusing for a parent. And in past experience in licensing in a state, you all know, if you've worked in licensing, that unless you really start to dissect all of these different programs, sometimes you might have a program that you say is non-compliant, yet they have a very high quality rating from the QRS side. So, and again, Dr. Fiene also said at the very beginning that there's no right way to do it. And I think that's very true. I think that as state licensing agencies, you have to start somewhere. And speaking to what Gwen said, she started in 2018 and here it is 2023. And, even though they worked really hard, they're open to seeing what still needs to be changed. And that, I think, is parallel to a state licensing agency doing CQI within themselves. And so I think that's very important. I do appreciate all of you being on the call today. You will get a certificate of attendance. That should come out in what, Amy, Shannon, a week, 2 weeks?
Probably in the next week and a half.
Okay, within the next week and a half, if you were on the call, you will get a certificate of attendance. And then also in the next maybe month or so, look for a new invite for professional development sessions for next year. We haven't quite solidified those dates, but we'll be working on that. And if you attended, you will get the email invite in your email that we have on file. The last thing, I know there are a lot of questions. We will try to kind of figure out who's asking what question and direct it to the correct presenter today and get back in touch with you all. When you do close your meeting today, there is a quick, maybe 5-minute evaluation. If you have time, we would really greatly appreciate you filling that out. It helps us know how beneficial this was for you all, whether you need more information, and helps us in planning for next year. So again, thank you all for being here. A special shout out to Dr. Fiene, Mark, and Gwen for your time. I know you all are extremely busy, but we do appreciate it. And for the rest of you, I wish you well and hope you have a wonderful rest of this week. Thank you again.